toe assessment is complete. I'm gonna move on to the specialty exams portion. First, I'm gonna be testing your cranial nerves. So cranial nerve 1 is the olfactory nerve. I'm gonna ask you to sniff a few things. Let me make sure that your nares are patent bilaterally, if you could sniff. And then sniff, good job. Now close your eyes. I'm gonna ask you to smell a few things. Cinnamon. Great. Cranial nerve 1 is intact. Next, I'm going to check cranial nerve 2, the optic nerve. I've already assessed that her pupils can sensually react to light, so now I'm just going to test her peripheral vision. I'm going to wiggle my fingers like this, and you tell me when they come into sight, okay? So if you could stare right at my nose. Optic nerve, cranial nerve 2 is intact. Next, we'll be moving on to her oculomotor, trochlear, and abducens. This is 3, 4, and 6. I've already assessed her vision with the Rosenbaum card. So next, I'm going to check her 6 cardinal fields of vision. If you could stare right at this reflex hammer, I'm just going to move it in various directions. No nystagmus noted when I held it out for lateralization. Now we're going to perform a cover-uncover test. If you could, cover your right eye, and I'll cover my left. Look straight at me. Now take it down. Cover. Now take it down. No deviation. Cover-uncover test is passed. So next we'll be moving on to the trigeminal nerve. This is cranial nerve 5. I need you to clench your cheeks really tight for me, like you're really angry. I'm just going to palpate the masseter and temporal muscles. And next, if you could close your eyes, I'm just going to touch your face and you tell me if it feels sharp, dull, or soft, okay? So I have a few things here. Soft, dull, or sharp? Okay, soft, sorry. You're okay. Dull. All right, cranial five trigeminal is intact. Moving on to the facial nerve. This is nerve 7. And now I need you to just make some funny faces at me. Smile, puff out your cheeks, and raise your eyebrows. Good. Cranial nerve 7 is intact. Moving on to cranial nerve 8. This is vestibular cochlear. So I'm going to do a couple of hearing tests, okay? I'm going to put this on top of your head, and you let me know if you hear it equally in both ears, and let me know if it fades out in one ear sooner than the other. You can hear it in both. Okay, equally? Good deal. And now I'm going to strike it again, and I'm going to place it on this bone behind your ear, and you tell me when you can no longer hear it, then I'll move it to the front of your ear. And you tell me when you can no longer hear it there, okay? Hold on, it stopped. I'm sorry, that was my fault. Operator error. So bone conduction is greater than air conduction on that side. Bone conduction is greater than air conduction is greater than bone conduction bilaterally. So vestibular cochlear nerve is intact. Next, we're going to do the glossopharyngeal and the vagus nerve. So first, I'm going to ask you to just swallow a sip of water. Good. Next, I'm going to check that her uvula rises and falls. I did this earlier in the exam. Say, ah. Good. And now I'm just going to stick this back there. It might be a little uncomfortable. Test her gag reflex. Gag reflex is present. And next, cranial nerve. That was cranial nerve 9 and 10. Next is 11, the accessory. So if you could just push against my hand, and push against my hand, and shrug up. The accessory cranial nerve is intact. And next is the hypoglossal. So for this one, you get to stick your tongue out at me, and then move it around in all directions. Hypoglossal cranial nerve 12 is intact. Next, we're going to move on to the musculoskeletal portion of the exam. So if you could stand up for me. So as you can see, for the purpose of the video, her spine is straight, her shoulders align with the iliac crest, and I'm going to test for scoliosis if you want to face this way. And kind of make your back like a table and let your arms dangle. The spinous process is straight, no curvature noted other than the curvature of her back. You can stand up for me now. Great. Now if you'll face me. And next I'm going to test her cervical range of motion. So if you can go side to side and forwards and backwards. Full range of motion in the cervical spine. And now I'm going to test your long spine. So if you can go side to side, get your yoga workout in, and backwards and forwards, full range of motion in the cervical spine. And I also assessed this whenever she was doing the scoliosis test. So next we're going to move on to the upper extremities. And I'm just going to palpate her joints for any warmth or crepitus. Can you move your wrist for me? Move this wrist and move the elbows. No crepitus noted, no warmth or tenderness in any joints. And now, wiggle your fingers, roll your wrist, straighten your elbows, and 80s hair. Full range of motion in upper extremities bilaterally. All right, now I'm going to take a look at your legs. So you can either sit in a chair or you can stand, either one. Can you wiggle your toes? And flex your knees. And move your hips side to side. Okay, full range of motion noted. No warmth or crepitus. Can you move your knees for me? All joints are freely movable. And can you move your hip for me again? I know it might be hard in the chair. Full range of motion in all extremities. No warmth or crepitus noted. Any pain or tenderness with any of those joints? And that completes our musculoskeletal. Next, moving on to the cerebellar test. I'm sorry, you're going to have to hop up for me one more time. Her gait is smooth and steady. I assessed it when she walked into my clinic/living room. Smooth and steady, ease of motion in all extremities. Now, if you could stand with your arms at your side and close your eyes, I'm going to assess for any swaying. I keep my arms up for safety. You can open now. Romberg test is negative, because we want it to be negative. There would be positive if there was swaying. So next I'm going to test her cerebellar function. Can you stand on one foot? Now on the other. Can you do it with your eyes closed? Awesome. Can you hop in place? On one foot? And on the other? Awesome. Now her cerebellar test is passed. I'm going to assess her fine motor skills now. With your eyes closed, I need you to touch one finger to your nose and extend the other arm outward. So, yes, perfect. And now, if you could touch each finger with your thumb. Fine motor is passed. And now I'm going to assess for her deep tendon reflexes. So if you want to take a seat in the chair, you can. First, I'm going to start with the brachioradialis. brachioradialis reflex is intact bilaterally. Now I'm going to go for the brachial, or biceps, excuse me. This one is a little bit harder to see, but I can feel it. And now I'm going to test her triceps. If you could just relax your arm and clench your jaw. This provides a nice distraction for the patient so they're not focused on what I'm doing. And then relax your arm. You can put its full weight on me and clench your jaw. Now I'm going to assess her patellar reflexes. Now I'm going to attempt to test her Achilles sitting down. If not, I will reposition her. Okay, relax your, there we go. And then also while I'm down here, I'm going to assess for plantar and Babinski reflexes. So if you could just put your foot up towards me. No Babinski noted. No Babinski, which is appropriate for her age. And I'm going to look at my paper one final time. Okay, I'm going to put a few, I'm going to touch you with a few objects and you tell me, just like we did on your face, if it's sharp, dull, or soft. Okay, now I'm going to do the same on her legs. Sorry, I didn't mean to scratch you. Go. Okay, and now still with your eyes closed, I'm going to place a few random objects in your hands, and you tell me what they are. Great. And now, so stereognosis is intact, and now I'm going to assess for graphesthesia. So I'm going to write a letter or a number in your hand, and you just tell me what it is. Could you do that again? Yes. Trying to draw it towards you. A. There we go. Yes. Graphesthesia is intact, and this concludes the specialty exams: cranial nerve, musculoskeletal, and cerebellar sensory.